Good day. Today we'll be discussing a project entitled Emulsified annatto reverse ovariectomised-induced osteoporosis in rat by downregulating sclerostin level. Estrogen deficiency due to menopause can increase bone resorptions and also reduce bone formations. This imbalance in bone rolling can cause bone loss and subsequently bone fracture. In our previous study among residents of Klang Valley aged 40 years old and above, we observed that 60.1% of our female subjects and 8.4% of male subjects were actually osteoporotic. In comparing to some of the key global statistics from IOF, we observed that there is a higher prevalence of osteoporosis among women, and the prevalence of osteoporosis increases with age. Most importantly, hip fracture can cause an increase in 20 to 24% in mortality within 1 year post-fracture. There are many agents used for treating osteoporosis, including bisphosphonate, selective estrogen receptor modulator like relaxin, denosumab, and also teriparatide. In our previous study, we also proved that tocotrienol, which is a subfamily of vitamin E, derived from palm annatto, can also prevent osteoporosis in animal model of castrations, glucocorticoid, metabolic syndrome, and alcohol. However, the application of tocotrienol do come with some limitations, whereby its bioavailability is inhibited by saturable intestinal absorptions and selectivity of tocotransfer protein. The question remained whether increasing the bioavailability of tocotrienol will increase its catalytic effect. And here comes cell-emulsified drug-delivery system SEEDS. It is a system based on surfactant, called surfactant, and oil and ethanol will help a drug to form a cell in gastrointestinal tract to overcome the saturable intestinal transport. It is suitable to be used for lipophilic substances like tocotrienol. In our previous study, we have shown that SEEDS actually improve the circulating plasma delta tocotrienol by 4 times in rats fed with SEEDS formulated annatto compared to those fed with unformulated annatto. However, we are still not sure whether these formulations will enhance the bone remodeling effect. And here comes our research questions. Does this formulation enhance the effect of annatto reversing bone loss due to estrogen deficiency in rats? And what is the mechanism? Our objective is to determine or compare the scattering effect of cis-formulated and unformulated annatto in reversing bone loss due to estrogen deficiency in rats and determine the mechanism of actions of annatto. We hypothesized that annatto formulated with SEEDS exert better scatter actions than unformulated tocotrienol in reversing bone loss due to estrogen deficiency through increasing bone formations. In this study, 8-month-old female respiratory rats were divided into 3 arms. The first arm baseline were sacrificed upon receive. The second arm, shown operator group, were not castrated, and the castration arms were ovariectomized and rested for 2 months for bone loss to develop. After that, the vehicle control group were fed with vitamin E strip corn oil, and the rest of the castration arms are fed with annatto, SEEDS formulated annatto, and also relaxin. After treatment for 2 months, the rat was sacrificed and their bone were harvested for analysis. Their right femur were used for bone histomorphometry analysis, and their lumbar vertebra were homogenized and used for bone remodeling peptide level determinations using multiplex ELISA. In the result, we observed that with castrations, there is a decrease in bone volume, but annatto with or without SEEDS prevented reduction in bone volume. In bone dynamic indexes, we observed that negative changes with castrations, and the annatto with or without SEEDS prevented the increase in single label surface and the reductions in mineral opposition rate. However, only annatto formulated with SEEDS increases double label surface and also increasing bone formation rate. In the bone cellular parameters, we observe that with castrations there is a decrease in osteoblast number and osteoid volume and also osteocyte surface. The single increase in osteoclast surface. Annatto with or without SEEDS actually increases osteoblast surface, but only Annatto with seeds increase osteoid volume. In terms of bone remodeling peptide in the vertebra, we observe that with castration, there's a significant increase in skeletal skeleton level and also wrinkle OPG level. However, annatto with or without seeds decreases skeletal skeleton level, but only formulation with seeds prevented the increase in OPG wrinkle level. Overall, we observe that annatto increased osteoblast number and also increased bone formation activity marked by increased osteosynthesis and also mineralization rate. This effect is mediated through a reduction in skeleton level, which is a negative regulator of wing signaling pathway important for bone formation. Seeds also enhance the bone formation activity and also the reduction in wrinkle OPG ratio. However, this reduction does not translate into a reduction in osteoclast number and also bone formation activity. In comparing the effect between annatto formulated with seeds and unformulated annatto, we see that the 4-time increase in the bioavailability of annatto caused by seed does not translate to similar degree or improvement in skeletal variable. Therefore, we postulated that skeletal therapeutic effect of annatto has a threshold, whereby further increasing the concentrations or bioavailability of the annatto will not translate to better skeletal improvement. Thus, we propose that further studies should consider lowering the concentrations of annatto in seed formulation to determine whether this will have a same efficacy as unformulated annatto. In conclusion, seed-formulated annatto exert marginally better skeletal effect compared to unformulated one in reversing bone loss due to estrogen deficiency. The mechanism of action of annatto is mainly exerted through increased bone formation through suppression of skeleton level, and the potential application of seeds should be the reductions in annatto needed to achieve skeletal therapeutic effect rather than enhancing the existing effect further. We thank Universiti Kebangsaan Malaysia for funding this study and American Nutrition for sponsoring the annatto use in this study. References and thank you.